Dr. Williams, there is currently a shortage of primary care doctors in this country. Why is primary care so important to the survival of our healthcare system?
Primary care is the basis of our healthcare system. When you think about it, it makes sense. Most people who are older than 40, their first memory of a doctor is really when they went to see their family practice doctor many, many years ago in the 1960s or 70s. Their first visit with that doctor was a critical point in their life, when they received their first shots, or when they got bitten by the dog, or when they had their stitches put in. All by the same person. You developed a relationship with that person. That doctor knew your family. That doctor knew when you were sick. That doctor was able to treat you specifically for the things that were important to you. And we've lost a lot of that content. We've lost a lot of that ability from the specialization which has taken place in medicine. Now, if a person has a headache, they see a neurologist. If a person has some kind of a cut, they'll see a plastic surgeon. This is driving up the cost of healthcare enormously. And it's also fragmented healthcare to the point where people really are confused. I see it every day. A person will come in with multiple problems, multiple concerns. They've had headaches, they're not sleeping well, they feel tired all the time. And very often they've already been to 3 or 4 different doctors. They've been to a hematologist, a neurologist, an ophthalmologist for who knows whatever problem. But they haven't seen one person who's concerned with their whole body. They have not seen a person who's concerned in a holistic way with them, with all of these different systems that are integrated. And when I see a person and they're complaining of headaches and fatigue and not sleeping well and so on and so forth, I can sit down with them. I'll ask them what is going on, not just medically, but what's going on in their life. What's going on with them? What's going on with their workplace? How are these things related to their overall health? What are their concerns? And very often you'll get a lot of different answers. But for the most part, what I find is that people just need a medical professional to listen to them, to find out what is the most important problem for them. And very often the answers to their problems are not really in getting a CAT scan or an MRI or getting some kind of highly specialized blood test. The answers are very straightforward. Very often it can be something as simple as you need 2 hours of extra sleep at night, or you need to take some more iron because you're a little bit anemic, or sometimes it's that you need to consider taking some time off on the weekends to spend more time with your family. Or sometimes it does involve some more complicated issues. Sometimes I do have to say, this is what I can discern. You have asthma and you have some high blood pressure issues, but we really need to focus on your diet because these are impacting both of those things. You're eating too much salt and you're consuming a lot of products that are adversely interfering with other medications that you're already taking. So we need to scale back on some of these things. But whatever the case is, 8 times out of 10, I can usually arrive at some kind of simple resolution that's not even therapeutic in terms of medication. It's therapeutic in terms of its intervention. What I focus on is getting to the root cause of the problem of a person and not treating them for their symptoms. Sure, you want their symptoms to get better, but unless you assess the root cause of what is bothering that person, then treating the symptoms is really literally just putting a Band-Aid on a deep wound. You're not really solving the underlying problem, and all you're doing is covering it up and waiting for the Band-Aid to come off and expose the wound again, and this time it'll be deeper and worse. So I think that this holistic approach, which we've had really since the founding of medicine in this country, has really been lost, in particular in the last 15 to 20 years, with the specialization which has taken place. And frankly, with the, I think, dysfunction of our current healthcare system and the disincentives that are embedded in our current healthcare system for people to get this kind of care, that has been the major stumbling block, at least, and the frustration for me as a physician, and I think for a lot of other physicians. But you're right, because of that, a lot of primary care physicians are leaving the practice of medicine because it is frustrating, because we can't really seem to be making headway. If anything, we're seeing an increase in the fragmentation of medicine. We are seeing a loss of what little effect that the primary care practitioner or generalist used to have. We're seeing a further erosion in our ability to influence outcomes in terms of preventive services and healthcare in this country. It hasn't gotten better, things have gotten worse. And at least in the short term, things are going to become much worse, because with the healthcare reform bill now, many, many more people are going to enter the healthcare market just at a time when a lot of primary care physicians are burned out and are leaving for the reasons I just mentioned. Right now, I think the prediction is there's a loss of 30 to 40,000 primary care practitioners, or a gap of 30 to 40,000 primary care practitioners in the country right now. What's going to happen when 30 million more people come into the system within the next few years? And of those people, there's a gap of at least 10 to 15,000 pediatric practitioners. So who's going to be taking care of all these new kids who are going to be entering, let alone the kids who are going to be born between now and when healthcare reform becomes fully effective in 3 to 4 years? This is a big problem, and as far as I can tell, it has not been addressed by anybody, either at the private level or the governmental level, or even at the municipal